Hey everyone. Okay, I love that I get to work in a practice where patients can just text us questions and then we can respond to them and have that dialogue that goes back and forth. Yesterday, a mom sent me a question. She was doing some research looking at SIDS, thinking about SIDS with her baby, and happened upon this article and wanted to know what I thought about it and if is there anything to take away from this or anything that we should do differently. Now, some pediatricians and some physicians will say don't Google your symptoms, and I think that's hogwash because you're going to do it anyways and you're going to see a lot of things just in your daily life, whether you're on social media, whether you're just chatting with friends. You're going to receive a lot of medical information, and getting good information is important, and having a resource that you can use to sift through and say, hey, somebody told me about this article. I'm not really sure how to contextualize it to, is it accurate? Does it apply to me? How should I adjust what we're doing for our own health or for our children's health based on this information? I'd prefer that you get that information and then ask a reliable source, which is why I was happy to kind of deep dive on this when this mom texted me this article that she happened upon when she was looking up SID stuff. So I just kind of want to talk through it and give you my take on it so that you can make informed decisions when it comes to your child and their health and feel like you have good resources. And if you have other questions, you can always drop them in the comments below. This is an article she sent me that comes from Toxicology Reports. Hopefully you can see it here. I'll try and zoom in as best I can. Vaccines and sudden infant death, an analysis of the VAERS database from 1990 to 2019 and review of the medical literature. So big picture, this is a study that's looking at vaccine administration and SIDS. Now everybody is scared of SIDS, myself included. SIDS is scary. It's something that nobody wants to think about. Fortunately, it is rather rare, but it's something that we always think about, right? We think about how can we prevent SIDS. When we look at SIDS, what we know from epidemiological information about it is that it typically occurs between 2 months and 6 months. That is the window where sudden infant death syndrome usually happens. Now, if you expand it out, there's some other acronyms like sudden unexpected infant demise or death that can be around that same time point. And then as the child gets older, there's other causes of sudden death that can occur, including suffocation and those sorts of things. It all gets muddled together. And then the thing that makes it more challenging for parents to wade through is some of it is tied to sleep habits and sleep, the ways that babies are put down to sleep. And then some of it is tied to, is it related to vaccines? All those sorts of things make it really hard and confusing, and also a little bit emotionally charged to discuss. And so that's why I just wanted to look at the big picture of this. So VAERS, VAERS, is the Vaccine Adverse Event Reporting System. And so what this person did, now just looking at the big picture, when you have a study that is just by one person, it always should give you a little bit of pause, like who is this person and why are they just the only person that is doing this study? And so this author is a journalist. He doesn't have any medical training background, but he does write a lot about vaccines and has a lot of promotional gigs that he does for different groups that are against vaccines. And so if you just do a little bit of Googling, you'll find that information out. In this study that he did, basically what he did is he looked through the VAERS database and said, when are VAERS reports that are associated with sudden infant death, how does that relate to vaccine timing? And so what he found was that of the 2,605 infant deaths reported to VAERS from 1990 to 2019, so over about 30 years, 58 clustered within 3 days post-vaccination and 78.3 occurred within 7 days post-vaccination. So based on this information, it makes it sound like a lot of babies that have SIDS just got vaccinated and then had SIDS right after that. And that would be, of course, scary information to hear, that 78.3% occurred within 7 days post-vaccination. It almost is phrased to suggest that 78% of babies with SIDS had died from SIDS within 7 days of their vaccines, which is certainly not what the actual number is. So when we think about, okay, where did he get this data? Well, these are self-reported events to VAERS. And so we're taking people that can report themselves that they had an adverse event from a vaccine. And what that looks like is you can go onto the VAERS database and submit your information. There's no proof that there was an actual event. There's no proof that a vaccination occurred. It is completely anonymous and it is not subject to any regulatory authority. I have a friend, Lauren Hughes. She's a pediatrician at Bloom DPC. And Dr. Hughes actually went on just in one of her recent videos and showed how, like, she just made up that she had a vaccine event related to a COVID vaccine and was able to submit that and have that go in. Now, the CDC and other immunization agencies use this as a signaling tool. Like, we want to know if there's something related, something that happens after vaccines. Sometimes they're related and sometimes they're coincidental. Like in the summer, there's more ice cream that's eaten and there's also more drownings. Does the ice cream ingestion cause the drownings? No. There's correlation between the two, but that doesn't establish causation. And so when we look at the VAERS database and we think about it, we have to take that into consideration, is that there's no causation that is understood from this information. And also it's self-reported. Nobody has to say, okay, this baby got a vaccine and then they died from SIDS on this certain days. It's just self-reported. And you would imagine that when a baby would have SIDS after getting vaccines, that would raise the red flags of like, well, maybe we should report this. So it's appropriate, certainly, to report those things. Now, so the big problem with this is it tries to say that there is causation between they got vaccines and then they died from SIDS, which is certainly a big leap, which supports this author's specific point of view about vaccines and calls into question, like, okay, are they actually related, or is this just causation, or is this correlation or causation, and who is actually reporting it and why are they reporting it? I'm sure these parents are devastated and they want that information to get out there. And if we look at, okay, there were 2,605 infant deaths during that 30-year span. Actually, probably if we look at all of the combined deaths just in the United States that are sudden infant death or related diagnoses, there's probably about 4,000 to 5,000 per year, which sounds like a lot, but there are a lot of babies born in the country every year. And so when we look at that number, that represents a very tiny sliver of all of the episodes of sudden infant death syndrome that we see in the United States. Now, obviously, of course, those are serious losses and terrible and tragic. And I've, had patients of mine that have passed away from SIDS, and it is terrible. And I've been there with those families, and I understand, how challenging that is, how tragic that is, and how life-altering that is for those families. I think one of the things that I always take into consideration when looking at reports like these is, well, what do we already know about SIDS? And so I kind of wanted to talk through a couple of the different things that we do know from big studies that have dramatically changed what we know about SIDS and how we approach SIDS. First and foremost, we know that sleeping position is really important for SIDS. Babies should sleep on their backs without a bunch of other crap around them. So there shouldn't be blankets or pillows or what are those things? Bumpers. Like, those are all cute for the pictures, but then you don't want any of those things around baby because you don't want baby to roll over or have difficulty breathing or anything along those lines. Unsafe sleep environments can affect rates of SIDS and increase the likelihood of SIDS. Exposure to smoke. Secondhand smoke affects babies' breathing, development, and can put them at risk for SIDS. And then prematurity and low birth weight. Those are the big things that we know that cause SIDS. Now, there's actually some large studies that show, first and foremost, that vaccines and vaccine exposure does not associate, there's no correlation or causation between SIDS and vaccine exposure. And then secondly, there are some studies that show that vaccine exposure, or receiving vaccines, I don't know why I keep saying vaccine exposure, vaccines actually reduce the likelihood of SIDS. So I wanted to show you this article. Let me just make this bigger. Okay, I'm just going to flip through all these pages from this article. Okay, so here's an article, non-immunization associated with increased risks of SIDS. This was a study from 2023 that looked at rates of sudden infant death syndrome and those that got vaccines and didn't get vaccines. And it actually found that there were higher rates of sudden unexpected infant death in the unvaccinated group. And so it's not entirely clear why this is. And again, correlation does not mean causation, but we have studies, and there's multiple other studies. There was a large study, I'm trying to think of when it was, in 2007, that found that babies had a reduced likelihood of SIDS if they got their vaccines. And it's not entirely clear why that would be. Now, one specific infection can increase the likelihood of SIDS, and that's whooping cough. Luckily, we usually don't have episodes of whooping cough, although we are in the midst of one right now. Whooping cough, the bacteria that causes it is called pertussis, and one of the toxins that pertussis creates can actually cause apnea in babies, which then can cause them to stop breathing. And sometimes they'll resolve that on their own and then they'll go back to breathing, but sometimes that will cause sudden, unexplained infant death. And so protecting them from pertussis is a way to protect from SIDS, if anything. Now, it's not all like vaccines are the best and we should just, always have vaccines. And I certainly think it is worth studying and it's worth getting this right and continuing to monitor and watch this closely. But this information from this article does not sway me to say, okay, based on this guy's analysis of the VAERS database and with his known biases versus the large amount of scientific information, that we need to do anything different when it comes to protecting our child from SIDS and protecting them from preventable diseases. Now, I do want to share one thing with you because I don't want you to say, well, he's just biased and has his views on it and hides the truth on other things. I'm going to delete this one. I just saw this in the past week in AAP News. Is this article about apnea more common in hospitalized preterm infants who receive their 2-month vaccines. And it talks about in this article, this was a study in JAMA Pediatrics that shows that these babies that are in the NICU, they were born prematurely. They're getting their 2-month vaccines in the NICU, which means they're at least 2 months premature, so they were very premature, had more episodes of apnea where they paused their breathing after getting vaccines. We know in NICU babies and premature babies, there's a lot of different things that can cause episodes of apnea. Stress, fever, respiratory illness, all those sorts of things can make them stop breathing, or choking on their saliva or choking on a feed. All of those things can make them stop breathing. That is just a known thing that tiny babies do, is they stop breathing when things aren't going right. And so this study actually showed that the rates of apnea were increased after those vaccines. Luckily, they're in the hospital and can be monitored closely since they're getting those vaccines. And so one takeaway from this is, well, we haven't seen this in babies that were full term or babies that got their 2-month vaccines outside of the hospital. But if your baby is in the hospital for an extended period of time because they're premature and they're getting the 2-month vaccines, it certainly is worthwhile and reasonable to say, okay, I want to stay in the hospital. I want to get the vaccines before I go home from the hospital so that we can closely monitor baby in those days after, so that we know that we don't have to worry about an apneic episode causing that. This was long-winded, but I hope it makes sense. And I hope it kind of shows you that, yes, we can look for information on Google. Yes, we should take into context who's writing it and why they're writing it. And then we should use the information that we have to contextualize it to the big picture of all the information that's available when we're making those decisions. And hopefully you have somebody that you can turn to as a trusted resource when those sorts of things come up and when those questions come up, because I want you to feel like you have a good resource when it comes to making decisions about pediatric health. There's a lot of information out there and it can be difficult to wade through, and parents shouldn't have to wade through it all on their own. You should have a trusted resource. So hopefully this has been helpful. Have a great day.